Okay, well, welcome everybody, and thanks for being here with us. I'm excited to help lead a conversation with some of our distinguished community leaders who have been really at the heart of the COVID-19 response and broader than that too, because I know they've also been involved in ongoing community initiatives that certainly relate to equity and inclusion and building a stronger community for everybody. So I'm very excited to speak to each of you. I'll introduce myself briefly, and then I'm going to ask you each to introduce yourselves as well. My name is Angie Widner, and I'm the CEO here at the Family YMCA of Black Hawk County. And like I said, I'm going to serve as moderator, so I get to ask the questions and turn it over to our panelists. So I'll start with Pam, if that's okay.
Good evening. I'm Pam Delagardelle. I'm the president and CEO for Unity Point Health Waterloo and Allen Hospital. A little bit about my background. I was born and raised in the Cedar Valley and continue to be passionate and committed to this community and the people that live here. We all know it takes a village to raise a child, and I feel really grateful to be able to be in a role where I can really serve the communities and the people that raised and educated me. I started my career as a nurse and in beginning my 9th year as role of CEO at Allen Hospital. My husband Rick and I have 5 children and now have 6 grandchildren.
Mm, that's fun. Congratulations. Dr. Nafissa.
Yes. Hi. Well, good evening, everyone. I'm Dr. Nafissa Egbuonye. I'm the Public Health Director for Black Hawk County. I've been in my position now for about 4.5 years. I'm originally from Niger, which is in West Africa, in French-speaking country, but I was raised almost everywhere in the United States, but I started my American journey in the Midwest in Illinois, and so I feel like I'm back in my roots here. But I've been in the field of public health for about 10 to 11 years, and so just like Pam, my experience also started at different levels, especially at the entry level in public health, which I think it's very important for every field, to get really that experience and understanding what frontline experience is like is something that's so important professionally. So I feel very fortunate to have grown into my role. And I have, I'm married, and I also have 2 children. I have a 6-year-old, Marcel, and a 2-year-old who's really running the show, Emmeline. So, but it's been an exciting journey to have a daughter that really is keeping me on my toes. So, thank you.
Thank you. Kingsley.
Thank you, Angie. My name is Kingsley Botchway. I'm the Chief Officer of Human Resources and Equity for Waterloo Schools. A little bit about my background. I am originally from South Carolina. I came up here to get my law degree, and I graduated a number of years back, and found my way up here in Waterloo. Have some of my partner's family in the area, so I'm just excited about being here and being able to help and be a support for just communities in the area. I will second Dr. Egbuonye. I have a 6-year-old who's actually a good 6-year-old, and I got a 1-year-old that basically runs everything, and we have to board up the entire house because I think he thinks everything is his. So we may have to trade notes later on, because it's been difficult, especially in the pandemic, as far as like keeping hands away. So anyways, excited to be here.
Okay, so we'll kind of do a round robin here and start with someone different each time. But to start us off, reflecting on the past year, past 9 to 10 months, and the challenges that we've faced with COVID-19 hitting our country and our community. Can you share a little bit about what have been some of the greatest challenges your organization has faced in the midst of this time? So I'm going to come back to you, Kingsley, to get your thoughts on that.
Thank you, Angie. Yeah, we faced some significant challenges just in order to keep our buildings open. I think that from a national level conversation, there's definitely been a conversation about wanting to make sure that schools stay open, and that's what we've tried to do. The ironic thing is that I'm really blessed to have Pam and Nafissa on the call today because their work has been instrumental as far as how Unity Point has really helped ensure that we have what we need to ensure our staff can get testing and get questions answered in regards to how they're feeling. And then again, Nafissa, Dr. Egbuonye has done a wonderful job guiding and directing us throughout this entire effort to make sure that we're running really good protocols to ensure that we're doing things with fidelity. And so I'm actually going to let them talk more about it because for us, it's just been really, how do we make sure we keep our kids in school and we ensure that our staff have the safest environment possible in order to do their job. And so that's honestly been the biggest challenge.
Mm-hmm. Kingsley, I'm going to prod you a little bit here. Is there a time that you look back upon and decisions that had to be made that you can kind of go back to and think that was a particularly difficult time?
During the summer. During the summer was a very difficult time because we were still coming off of, not knowing much about COVID in, April and May, having to shut down our entire school system from March and not coming back. And again, it was just hard conversations. And so right before the beginning of the year, but the school year in August, it was tough. It was a roller coaster ride of emotions and feelings because, we didn't know whether or not the plan would work. We didn't know whether or not our staff were willing to move forward with the plan that we put forward, or community for that matter. But kudos to everybody involved. Kudos for everybody that was a part of Return to Learn committees. And a huge shout out to our staff because, again, these were all plans, and plans without implementation, unfortunately, at times don't work. And our staff really stepped up and been able to provide a high level of education for our students in Waterloo.
Great. Thank you, Kingsley. Pam, I'm going to turn over to you. Greatest barrier your organization has faced during this time of COVID?
And so as I prepared for this, there were different challenges and barriers along each leg of this journey that we're going to call the pandemic. I think for me and our senior team, the very beginning of the pandemic were really dark, scary days. I remember not sleeping very well for 2 weeks. We knew we did not have enough PPE. And one of the things that I look back on right now that is such a source of energy for me and pride is all of the community that came out and came forward to take care of us. So, right back at you, Kingsley, the Waterloo schools were there for us, John Deere, UNI, Powers Manufacturing, they just produced all of this personal protective equipment and really surrounded our staff so they could take their mind off the worry and really care for patients. And then, the not having enough scientific evidence right away, not knowing, the clinical knowledge, and we didn't have drug treatments initially to care for these patients. We have come such a long way on that regard. But as I look across the entire pandemic, the one thing that stands out really is our workforce challenges. So we were completely ill prepared. Well, we have 3,300 staff people. The massive surge of critically ill patients that hit our hospital and our clinics and our urgent cares were overwhelming. And so, it's all hands on deck at Allen Hospital and in our clinics. Every leader, has pledged 10% of their time in support of patient care. And so we really came together as a work family, and I think a community family have stepped up really to help us care for patients. So workforce is our biggest challenge.
Thank you for sharing. Dr. Egbuonye.
Wow. Wow. So first, I think for us here in public health, COVID-19 gave us an opportunity to be visible. Very often, public health is confused with healthcare. And for the past 4.5 years, my goal has been to redefine public health in Black Hawk County. I don't want sick patients. I want sick patients to go to Unity, Point, Mercy, One People's. Like, that's not our lane, And so I tell people public health is not healthcare, but it gave us the opportunity to highlight the invisible aspect of public health, what we normally do on the day-to-day basis, So now when I hear communication and I hear people use terms like contact tracing, disease investigation, and surveillance, I'm like, oh my goodness, that's public health's language. But I think the biggest issue that we've faced is the lack of funding in our public health infrastructure. And so you never want to fund public health in the midst of a pandemic. You want to fund public health before a pandemic so that we have the proper infrastructure, and so that's why the investment of public health is so critical. As Pam shared, workforce is very key, and our fields are very specialized, and we're always trying to find ways of recruiting also diverse populations, like asking ourselves, what can we do more, and how do we, even partner with colleges or university? What is it that we need to do so that people also understand the different fields within the healthcare and public health and what we have to offer? And so I think that has been one of the biggest challenges. For us, also communication. We in public health, I mean, we're usually we're used to communicating scientific information, but it was also important that we communicate scientific information in such an effective manner that it actually also influenced behavior change. And so we were constantly like, okay, how do we do this in a culturally responsive way so that people understand what we're asking them to do? And so that really takes intention, looking at our data and recognizing the disproportionate impact that it had on certain populations, communities of colors, and asking ourselves, like, what's the best method of communication and outreach? And so I think for us, overall, it really has been, the lack of funding of public health and the impact it can have on the entire system. If we were not able to do our jobs effectively, hospitals could have been and were also at capacity at sometimes, and so that's our relationship, and that's what we need to strengthen so that people understand how we are connected. And also with the schools, engaging with the superintendents, having bi-weekly meetings with the business community. Public health is really in every aspect of our lives. And so I think COVID-19 highlighted that, but I think for us, workforce development and the investment of public health has been really the two things that, we are going to need to tackle in the next, years to come. So thank you.
I bet there are many in the community that are now tied into your social media accounts in ways that they were not before, right?
Yes,
So there's going to have there's going to be a ripple effect of other ways to educate, to educate people in other areas. Nafissa, I remember having a conversation with you early on, and I said, could you ever have imagined this in your career? And do you remember what you said? You said yes.
Oh, okay. Yes.
You said, I knew someday there would be a pandemic, like,
yes.
And it's just like something that the normal citizen doesn't think about, but a public health professional, you clearly were already thinking that was a possibility in your career.
I just didn't think it was this soon, Angie, because I still needed to finish the restructuring. We still needed to rebuild. So I think that's been the hardest thing, is that after restructuring, boom, we've been hit with a pandemic. But I have to say, I'm so grateful for the community. I mean, as Pam and Kingsley mentioned, the community having the trust in us. There are times where we didn't have the answers, and I heard, comments like, what does Black Hawk County say? Like, let's listen to Black Hawk County. And so I thank every community member out there for just trusting us in us, and also being patient with us, because this also, I mean, we were all trying to figure out what was happening, and so that patience, we receive it with gratitude.
Mm-hmm. Great, thank you. Mayor Hart is joining us, and I know that he wants to make a few remarks. and share some news. And so there you are. Hi, Mayor Hart.
Hello, everyone. Just really quickly, just want to say health and well-being is a very important conversation. Looking back over 2020 and all the challenges that our families are going through, our friends are going through, things that we're going through personally, it's very fitting to hear Dr. Egbuonye talk about public health and having all of you experts on there. And Kingsley, you know, being a part of an organization in the HR department, trying to figure out, do you contact trace for this or do you do that? This kind of changes the whole game of what we're involved in. So I'm glad that we have such incredible professionals like you on this panel today, which is a continuation of the conversation of Dr. King's message and community essential in every aspect from healthcare to economic development. All of those areas are important. And today, along with several hundred other cities across this entire country, we are commemorating those that have been impacted by COVID, whether family or whether it's you or whether it is a coworker, but for all the many people around this country that have either lost their lives or are struggling right now, we are honoring them today with the lighting of our amphitheater and our city buildings in an amber color in efforts to try to commemorate those. So in your hearts and minds, please continue to support those that are challenged, but I'm just grateful that we are able to honor, along with so many hundreds of communities, on COVID and its challenges.
Thank you, Mayor Hart. I can attest from my vantage point that community has definitely been strengthened through this. You know, even sitting here with each of these panelists, the YMCA has had a deeper, richer relationship with each of these organizations and many others through this. And I think that we'll continue to hear this as we have this conversation and hear from them about the way in which their organization has been impacted. So thank you for joining us and making all this possible for us too, to spend our week like this. Thank you. Okay, so let's talk about some of the key initiatives or changes that your organization has undergone over the past year so that you could address disparities that may exist in health and well-being in our community. And that may be related to COVID, and that may be, another outside of COVID initiative, because I know there have been some things that have run concurrently during this time with COVID efforts. So Kingsley, I'm going to ask you to kick us off here. What key initiatives or changes?
Yeah, thanks, Angie. You know, we had a number of initiatives we actually started in February. I gave a huge speech to many of our staff about the changes that we were making from a health and well-being standpoint across the district. I'll just highlight a few of them. One, we moved to really dedicating our entire district towards a better, more in-depth conversation on health and well-being. And so we have all of our staff have to go through a survey to assess where they're at. And then basically, with the help of our insurance company, Health Partners, work through different aspects of their own individualized plan that they have to meet in order to meet different health and safety or health and well-being goals. That just changes the dynamic. You hear a lot about that in the private sector, especially. We're excited because we'll be working in tandem with them to write a white paper in regards to this effort, because it is new for school districts to head down this path. We bolstered our employee assistance program so that it was more than just a telephone call, but in conjunction with Unity Point, you can actually go and see individuals. You can have counseling help for not just school district issues or work-related issues, but personal issues as well. We care deeply about our employees, not necessarily just inside our locations, but also when they go home as well. And lastly, again, there are a number of different things, but the major pieces, lastly, would be the employee clinic. And so in conjunction with, again, Unity Point, to offer an employee clinic, again, many times this has been done in the private sector, not necessarily done in the public sector, have an employee clinic so our employees can go to this clinic free of charge and get the help that they need. It's been transformative. We have a lot of different work yet to still be done in this effort, as far as having our nurse practitioner reach out to our employees in new and engaging ways. To have that dedicated person there has just been phenomenal. And as we talk about whether it's COVID, whether it's the flu, whether it's whatever issues are coming up, we know that we have some dedicated health professionals to work us through whatever problems we may be facing. So again, it's ironic again that we have, Pam on the call, because a lot of the work that they have done to ensure that we have those opportunities for employees can't be understated. It's been huge. And we're just excited because we're moving into our second iteration of that phase this year. And then we'll move to our next plan year after the end of this calendar year. And the sky's the limit. We're continuing to look at what other benefits we can provide and move forward on. I'll give kudos to Carrie Dara. She sent a message out a long time ago that employees move in general, when looking at the regional kind of movement of employees across the Cedar Valley area in regards to benefits. And so we have spent an inordinate amount of energy and FTE to focus just on how do we provide the best benefit package possible to both recruit talent into the area, but also to keep them in Waterloo as well.
Great. Thank you, Kingsley. Dr. Egbuonye, tell us a little bit about the initiatives and changes that Black Hawk County Health has been engaged in.
Well, in terms of initiatives, especially in terms of addressing disparities, I think one of the things that has been important in the field of public health is understanding the root causes of those disparities. And I think that, one of the things that we didn't do well, because it's important to recognize some of the mistakes in fields, we're human beings, is that, public health started with this understanding of the social determinants of health, right? So housing and employment and, location, the different types of factors that influence your health. But public health did not ask the question, is that why is there disparities in the determinants of health? I don't even like using the term social because it becomes very political. So determinants of health, And so the health department, we took on this role as a health equity strategist because when we were considered the worst place to live for African Americans, both in Waterloo and Cedar Falls, everybody was like, oh, it really sucks, But I think it was an opportunity for us to really, utilize bad news to transform for the betterment. And so we decided that we were going to be health equity strategists and called racism as a public health crisis, because it is, right? So internally, we've done a lot of systems thinking approach, and we've engaged our community partners, which has been very exciting to see the level of engagement in regards to that. And we'll continue to do that this upcoming year. In March, we are launching a health equity training curriculum with the University of Iowa for all staff, so that they can go deeper into understanding what this means, But in having that framework really change how we think about program development, asking ourselves who's missing at the table, what are we missing? Where's the disparities at, and also not implementing solutions because, making these assumptions that we know what's better for people, but being in partnership with people and asking them, okay, what is it? How can we support you all in regards to whether it's breast cancer prevention, whatever health initiative that will make a difference in those communities. That's what we do. So it hasn't been easy. These are very difficult conversations to have, but I think it also has created a bond, within this organization. And in addition to that, some of these conversations, we've realized that there's a need for well-being. There's a need for resiliency, especially with COVID-19. And so part of our curriculum also will include well-being and resiliency. And what does that mean? As we try to better understand our system and how people navigate it. So, and also the community health needs assessment. It's just been so exciting to partner with our healthcare systems. I mean, I'm filled with so much gratitude for the space that you all provide for public health to do this, because that's what public health does. We supply the data. And so I hope that we will continue to be the lead, but in partnership with our healthcare systems and our overall community to get the information that we need to move forward. Thank you.
Yeah, and what a great way to be efficient with resources, right? Because all the major healthcare systems came together in the community needs assessment process, and then the equity work that Black Hawk County Health has been doing has been really outstanding. As a participant in some of those sessions, it's been extremely impressive. And I wonder, is that information available to the community at this point? Is there a place people can go to kind of see where, because it's been months and months and many meetings and lots of input, right, to get to some stuff that you can kind of grab onto, and all kinds of organizations can grab onto to think about how they can lift up the community. So Nafissa, where would that be located?
Yes, so we are building our racial equity tool. And we are building a tool that any entity, whether it's business, whether it's youth services, K through 12. So we're putting that together. That is what the community will see in the upcoming months. It's just with COVID, vaccine is priority. And so that's where, we got to get people vaccinated. So that's but we are going to do that. And then we are launching a new website, and that will be on our website. But everybody will have access to this tool. This is, like I said, none of those resources are just to the Black Hawk County. This is data that belongs to everybody.
Yeah, wonderful. That's great. You have done a lot of different things this year. A lot of things happening. Thank you for that, for all your leadership and work around those initiatives. Pam, can you tell us a little bit about the key initiatives and or changes that may be or may have occurred at Unity Point over this past year?
Certainly. So I am absolutely struck by the great work that's going on and the base for which we can build on. We have the same care and coverage partners as the Waterloo schools. And, you would expect that healthcare professionals should be, following their own best advice. And so it's, really fills up my heart to hear Kingsley talk. He may actually even be farther along with some of his employees, in terms of the engagement in those services. So we do offer those same sorts of things. This year, we've really put a focus on the psychosocial aspects, though. Our staff has seen and experienced things that I think give them some PTSD, and, they're in the same storm, but maybe a different boat than other people. And so they have those same things going on at home too. So we have really leaned in and are offering a lot of virtual counseling, and people are really taking us up on that. We're trying, we do this daily dose of hope, where we try to talk about something inspirational and get that out there. And then, something else we do is we try to celebrate successes. We have this code celebration. So when somebody is finally released that's, been in the hospital for a long time, we try to celebrate those things. On the flip side, we're very involved in the community health needs assessment. And, we have like 120-page plan of attack. But, again, mental health services, are at the top of the chart. Our health access and transportation, is second. And then women and children's health and nutrition, obesity, and wellness. So we have really plans to, attack most of that. The health equity strategies that Nafissa talked about, we have a great opportunity with the rollout of these vaccines. We know that there are going to be disparities in how people latch on and engage in this vaccine. I would like that maybe we can 6 months, a year from now, be able to do a look back and see. I mean, this is going to be a great test of how, we can really engage different groups of people in getting this vaccine and staying well. And so I'd sure like for Black Hawk County to be the best vaccinated county in the whole state of Iowa. And, we have the tools to do it. We just have to come together as a community and do great education and make sure that we, get to where people are.
Thank you. I like that goal. It's a good one. Something to hope for in 2021.
We just have to get the vaccine, right, Nafissa? It's got to come.
We got to get the vaccine. I think the state is over my communication, but I won't stop. They know I'm stubborn. I won't stop. So
it's going to be a great test for us, I think.
Yeah.
I like both of your smiles and hopefulness around this, and perseverance and persistence, it sounds like. That's good. Thank you. So tell me a little bit about what you've learned. And with that, it may be a look at different actions that you may have taken along the way as you look back in retrospect now in responding to both the current crisis, but also generally, and this may even go further back than this year, what are lessons learned in terms of how to create more equitable health and well-being for every citizen of our community? So Pam, I'm going to come right back to you with this one, and love to hear your thoughts.
There's so many things. So I'm going to, really focus on one of the most important things. We recognized during some of our workforce challenges that, a decent minimum wage, so people, have a decent standard of living is really key to being able, to build health and wellness in a community. And so we made, a really tough decision, but a good decision to increase our minimum wage to $15 an hour. And that's going into effect in the next couple of weeks. As a result of that, our workforce challenges, we really leaned in and looked for different ways to engage the community. So we've always had a great working relationship, supported the Waterloo Career Center, but now we're looking for ways really to educate the community, to bring up young people in this community into healthcare careers. So we, have been doing lots of different types of recruiting and education about healthcare and healthcare careers. And one of the things that has come about as a result of, our recruiting efforts is to pay for, so anybody going to Allen College that applies for this scholarship, we will pay for their college, their final year in exchange for them to come to work at Allen Hospital. We're also starting a family medicine residency program here, really to recruit people who want to be a family medicine physician in this community. So people that grow up here want to stay here. And again, we will have lots of incentives for those people as well. So, in terms of what are we doing differently, I think we learned a lot around virtual care and how we can engage that. People don't necessarily have to come to us if they have transportation issues. And so, and we're doing hospital at home as well. So, a lot of new innovation, and, those are just a couple of things that we've got going on.
Mm-hmm. Pam, are you finding that the current pandemic is creating a more interest in healthcare as a field of as a career for young people and others?
I'm not really sure. We've had our heads down pretty hard. There's been a lot of, that healthcare hero stuff. I don't know if that's really attaching to people. On the flip side, we had just as many people say, I'm out of here. I'm retiring. I didn't sign up for this. And so I think what it's really doing, it's very purpose-driven work. And if you're called to do the work, there's a lot of purpose right now. And so, we're really working to identify those people, and they don't have to be, young students. we're looking for people that want to change in career, and we're helping them go to school because we're going to need more and more healthcare professionals. I mean, we knew we would be facing challenges. We did not anticipate a pandemic really to accelerate those challenges.
Yeah, for sure.
We have been marketing to that though. You know, if you've seen our little guy, you know, calling on healthcare professionals, and we're doing a lot of call to action, you know, think about healthcare as, you know, as a new career.
Yeah. Well, and so many families are being touched in a different way, you know, with having a family member receiving care during this time. And so people are just, I think, probably recognizing healthcare workers in a different way. And hopefully that will have an impact, right?
We hope so. It's the long, you know, journey, but hey, we're in it for the long road here.
Right, right. Thank you. Nafissa, tell me a little bit about what lessons you've learned and what things you may have done differently over the past year or more.
Lessons learned. And this is a lesson I think, you know, speaks to what Pam was talking about in terms of vaccine. You know, we did a vaccine survey and we have the results. And I was just reviewing the results of the vaccine survey. And Kingsley, you and I, we talked yesterday, or was it last week, actually last week, about, you know, how to tackle this. But, you know, when you have communities that have been marginalized historically and that have gone through, you know, unfortunate, you know, studies or treatment, and now all of a sudden here we are expecting these same communities to be eager to be vaccinated. I mean, that's a problem, right? You know, and so for me, as a public health practitioner, I've been asking myself, you know, how do we reckon with history? You know, recognizing the ramification of our history and its present day impact on people and the decisions, because it might not necessarily be those individuals that have experienced the pain and the trauma, but it's been generationally passed down, right? So that now here we are trying to promote a vaccine that is effective, that will save lives, but there is so much uncertainty and people are afraid. And so my responsibility as a leader is to always recognize that fear and that uncertainty and where it comes from, you know, and work with, you know, NAACP and our Black pastors and think about, you know, what are some of the strategies we can do to effectively educate so that we can save more lives, you know. So I think for me, that's been one of the hardest things, you know, is recognizing also some of the history in public health and how that influences present day behavior, because that's all public health is right now doing, is communicating and helping to promote vaccine effectiveness and also behavior change, you know. The second thing, I think that also public health, as I stated earlier, is very science oriented, you know, but here we've seen people, you know, science and values intertwined, you know, and it's like, oh my goodness, like, you know, Dr. King says, you know, there's no need for science and moral values to compete, like they complement each other, you know, but right now, that's what's happening. You know, you have people that will say comments like, you know, God will save me. I don't need to mask or wear, you know, physical distancing. And we're like, wait a minute, no, that's not how it works. Wait, you know? And so it's really highlighted what we can do more. I mean, I think there's more opportunities to continue to educate our community about health, and well-being. And so I think for us, you know, that's some of the key things, you know, there are certain things that were in particular out of our control. And I wish that we had more control, you know, I wish that at different levels, whether it's the state or federal, that there was a better understanding that local public health needed that control, because we are the ones that are here with our community. And so, I mean, if things were to change differently, those would be my recommendations at the, state and federal level, because we were in direct contact with our healthcare systems. Every day I was getting called about COVID additional test kits, until we got into a rhythm and we were able to get that. But, again, those are things that, I wish that, whether it's the state or the federal, that there were, local public health practitioners that were involved in the decision-making process of how some of these issues would be addressed.
Was there previously a roadmap for that kind of coordination between the public health department and the healthcare providers for coordinated response, or has that grown out of this that could be used and switched up in the future if it were needed?
Do you want to speak first, Pam, or I could?
Well, I think we do tabletop exercises all the time on lots of different things, but there's nothing like the real deal to put it to the test.
Yeah.
I am just blown away. When I talk to some of my colleagues across the health system, they do not have the same level of engagement with the local public health, with local employers and government. I mean, we enjoy something really special here in the Cedar Valley. I mean, even to have Mercy One, Unity Point Health, People's Community Health Clinic, all of the providers pulling in the same direction is pretty amazing.
It's great to hear.
Yes, and I would agree to that. Originally when I started, there was the regionalization of our preparedness. We were originally a 4-county, and then, I remember my first year, they made it, the state asked for it to be an 8-county. And then by the third year, they asked for it to be a 16-county. And I said, no, we're not going to do this, because, when pandemics happen, it's like, it hits the county, and so I said, at the county level, we have to have our house in order before we start expanding, and so that really, that set the stage into how, I do believe that we have to invest in local preparedness, starting with Blackhawk County, and I hope that these, once the pandemic ends, that these are where we would have the opportunities to revisit everything and say, okay, next time, this is how things will happen.
You mentioned, in terms of overcoming some of those fears and barriers that people may have regarding the vaccine, and you mentioned churches being one of those places for communication. And, with the school being a trusted place for families, do you coordinate with the school as well in terms of pushing communication about a safe vaccine, home with kids that get to their parents? Has that been an approach you have used?
Who's the question for?
Dr. Egbuonye.
Oh, I'm sorry.
Yeah.
Oh, okay. So yeah, sorry, I thought that was for Kingsley. No, we do. Right now, the superintendents are actually collecting the data in regards to the number of staff that are willing to take the vaccine. So we worked on that survey with the superintendents. If they release all that, the survey, so they're getting the results. So there's all of these different elements in terms of the how to educate in regards to the vaccine, which we do. But I think also one of the aspects is also, this is a period where there's a lot of fake news that's, traveling. I mean, a lot of it, and so even when it comes to, I hear people say, well, in this study, we heard somebody died. My response is, let me see the study. because I also check for other variables. It's not just reading, but looking at the source, looking at the sample size, understanding, did this person have an underlying health condition? How old was this person, So there's all these other factors to consider before just accepting information that might not necessarily be reliable. And so those are some of the things out of our vaccine survey we've also identified that we are going to tackle. On Wednesday, we have a vaccine planning meeting. We're going to update the healthcare systems. So we can also do that in uniformity. So everybody knows the kind of education we're all sharing. But I also, going back to what Pam said, we also need the vaccine. There are some people that are eager, ready to get the vaccine. And I'm just like, give me the vaccine because people are ready, and so we run into situations where there's extra doses. I'm telling the healthcare system, the pharmacies, like, put that in someone's arm, whoever's ready, let's go, but I mean, more education is going to happen, but the truth is we need more vaccines in Black Hawk County.
Interesting. Good to know. Kingsley, going back to the question about, lessons learned or different courses of action that you may have taken in terms of thinking about how to uplift health and well-being in our community. Can you think of any of those that would apply in your role? Probably thinking about employees in particular, but maybe students as well.
Yeah, absolutely. I think for us, two things or a couple of things that come to mind is, for lessons learned is we just have amazing staff. This was a tumultuous period, as already had been mentioned. There were still a lot of questions left unanswered, and knowing that our staff members were willing to come back to work and be there for our kids, it meant a lot. I mean, I'm not getting chills thinking about it right now. And I think also for the community aspect, I mean, we were talking about for the students and parents and families of Waterloo schools, trusting us to, have an environment that they can send their kiddos to, trusting us that we were going to, talk and discuss and plan and implement in the way that we said we were going to. I mean, that by itself can be, understated because it meant so much to the broader community, from the worker report standpoint as well. That's one part. The other part I would say is, one thing that I've learned is just, leaning into these folks on the call, leaning into the community. It's been stated, but I want to make sure it's stated again for those that may have forgotten. Again, being from outside of the community and coming here, normally, especially when I've worked in other districts, either, being in another district or doing consulting work with another district, school districts are unfortunately cities unto themselves at times, which makes it really tough to engage with other partners when it comes to major issues. I never felt that way here. This community has been largely welcoming. It's been amazing. And knowing that I can ask for that help and get that support has been transformative, not only for me, but also the operation and our staff and our students in Waterloo schools. And so those are two big points that I want to highlight from an overall benefit standpoint as far as lessons learned. Some things that I'd like to change or I'd like to go back and change potentially before is, we did provide, when we talked about doing more health and well-being, we did provide, more diverse mental health experts. So we have a list of people that we want people to reach out to because we felt like that's important as we're talking about mental health and well-being. So we did put that out there, but greater advertisement, greater focus on it, I think is a piece that's important. We spent a lot of time talking about race and space during the summer, especially in light of the murder of George Floyd and the protests that were occurring throughout the country. Myself and Dr. Mohorn sat down with our staff of color, in particular our Black staff, and met with them over a couple of months, only 2 months actually, just to get their feedback, wanting to hear from us directly as senior leadership. Unfortunately, when the school year started, like in most initiatives, it just stopped. We started working on other things just to make sure we were handling all the things we needed to handle from that vantage point. If I could go back, and we will be putting that forward in the next couple of months again, I'd make sure we made time for that space, because, you know, that it doesn't go away. You know, all these things that our staff are feeling in relation to the protests, coupled with COVID, coupled with everything else, it never went away. Luckily, our staff were able to compensate, our staff were able to move forward to do what's best for our students and do what's best for their families as well. But we need to get back to providing that that space again. And so those would be the two areas. You know, I failed to mention that we have a dedicated wellness coordinator as well with our staff to provide an even closer, you know, relationship with our staff, with our health insurance agencies. I mean, just to help that communication go better from a health and well-being standpoint. But again, as we talk about the inequities within healthcare in general, and you know, Dr. Egbuonye and again, Pam mentioned it as well, as far as, you know, what will be the challenges, or what will be the next steps, and we talk about the vaccine and how we're going to have that conversation. If I could go back and spend more time building those relationships at the onset of our school year, I don't necessarily know it'd be as insurmountable a task. I'm not saying it's not a task we can do, but there's just going to be more difficulties because of the fact we didn't spend that time. And so we're going to spend a lot of time over the next couple of weeks, so a couple of months, doing that, regardless of whether or not people want to take the vaccine or not, just because we believe it's important for our community, our school community, but also our community at large. But we also want people to take the vaccine. So that's going to be an important part of our communication moving forward from that perspective as well.
Thank you. I appreciate that all of you have touched on this, that, you know, the COVID and a pandemic, and we think a lot about physical, the physical health. But, you know, that coupled with the ways in which issues of racial injustice have really been brought to the forefront this past year has made mental health, you know, even more critical. And so the supports that, you know, you guys are providing to your staff and really creating probably models for other entities in the community, you know, it's really important. It's an important conversation to have. It's a conversation we could spend an hour on or more, just on that alone. So thank you for, you know, touching on that again. So we have about 6 minutes left. And so let's look forward for the next few minutes. So instead of thinking back of, you know, what has happened and what's been happening, if you could look forward and think about the ways in which you may be able to, or your organization may be able to impact health and well-being in the Cedar Valley. What do you think about? Where are the gaps? Where are the opportunities? What do you look forward to and get excited about in the pursuit of your work? Dr. Egbuonye, let's start with you.
Woo, Angie. Wow. Okay. So first, Blackhawk County is vaccinated, right, Pam? We're vaccinated. Number one, we're vaccinated. So that is, you know, there's nothing else that's my priority over this. It's the vaccination. But I think that one other thing, once COVID settles, I've heard, you know, for several years now about mental health, you know, how we need to tackle mental health, you know, and mental health is not necessarily that, you know, it's part of, you know, people, you know, people can be very depressive on, you know, medication, but that mental well-being also, you know, you can have a really bad mental health day. I mean, we all go through that. So I think also is to be able to tackle mental health, you know, and also trauma. You know, I envision being able to do an environmental scan. You know, this is the public health part. Surveillance doesn't necessarily have to only be for infectious diseases. Like surveillance can even be for mental health, you know, working with the healthcare system, with the schools, being able to identify hot spots. Are we seeing trends? You know, what kind of interventions can we implement in those places? So really, I am looking and hoping that we can invest in GIS mapping to get a better sense of our community. That will help us with our community health needs assessment, and also bringing in different experts and different also studies that, communities have done to tackle, mental health issues. I really think that I'm very solution and positive oriented person. So I do believe that, when we look at the list of providers, this is something we can tackle here in Black Hawk County. We can do it. And so I look forward to those really key initiatives once the pandemic is over.
Great, thank you. Pam.
Well, of course, vaccine is top on the list. We're going to learn a lot together as we do that. There are things like getting books into every child's hand that come for their well child visits. So that coaching and education that you do when moms have new babes about the importance of reading. So there are lots of different activities going on in places that you wouldn't expect. You're going to see our healthcare organization be more involved in, getting to the root of the cause. So food deserts as another example, transportation. We're not talking about housing yet, but those hotspots. I was just delighted to hear you say that. I spent my afternoon, so we're trying to start already getting ahead of the game. We are going to be paid based on keeping people well. Right now, people in healthcare have an inverse relationship. We get paid when people are sick, and there's something really wrong about that. The more sick you are, the more we get paid. And so we really want to go at risk to be paid for keeping people well. That's where, we were talking about the chime maps, these hot spots. And so what we learn from distributing the vaccine and getting them out into communities that need special types of help. So, it might be an area where there's not insurance, and there's, a group of people of an age group that need more prostate health or more breast, cancer screening. We're going to be able to spot that now based on our data and go in and do education and provide services. And we'll be more motivated to do that when we get paid to keep people well. So this experiment that we're doing with the Waterloo schools is super exciting to hear about the engagement, because we're going to need more of that to really be successful. And when we have a healthy community, then we're going to have a healthy economy. It's going to turn around the conversation.
Mm-hmm. It's so cool too, all the connections there, because you're not only helping them set up a system that keeps their employees healthy, but you're talking about setting kids and their families up for getting into, once they get into the school system, they have a basic, they've already been introduced to reading, and they have a, their development has already been really invested in by the time they even enter pre-K or kindergarten. So, all the different ways that there's intersections between these organizations is awesome. Kingsley, looking forward, what makes you excited? Where are the opportunities?
Yeah, when I heard Pam talk, I totally forgot my point, because I was super excited to hear, what can the school partner with? I'm always interested in being the cutting edge in that regard. I'm very interested in the work that, Unity Point will be doing, and obviously interested in making sure that, the entire county is vaccinated as well. For us, it's not an excitement as it is a challenge to address the education loss that's occurring right now with COVID. That's going to be something that's going to take hours of our time as soon as COVID is abated just a little bit to have that conversation. And we started that conversation a little bit in earnest this week as we're talking about budgeting that's coming from this, or finances that are coming from the state, and how we're going to budget appropriately. From a less bleak standpoint, wanting to dive into more from a telemedicine standpoint to ensure that our employees can have access to the care as quickly as possible. My whole goal is to make sure that, in conjunction with what Pam was saying, how do we get people excited about having ownership of their own health and well-being, access not being an issue. If you can access it on one of your computers that you use at the school and touch base with either our clinic or somebody at Unity Point or Mercy One, whatever the case may be, we want to make sure that access is available. And so I'm excited about what that new step will be in regards to that type of planning. And lastly, again, it's to bring it around back to race, around how are we answering the question over and over again, based on what we're doing, around asking this, are we doing things, our initiatives that we're doing, is that addressing systemic inequality? And I think, we have that as our senior leadership, questions that we ask in regards to anything that we're doing. But I think there's a deeper level that we'll need to hit when we're having that conversation as we move forward in the next couple of months, because the inequities will obviously rear their ugly head when we see more from the data standpoint. And we need to, I appreciate everybody on the call, because I know that everybody on the call has those tough conversations, is very blunt about that. I think that it's the next step of how do we make sure that we're empowering people in every sector to have those tough conversations, because if everybody is focusing on that from that lens, it makes our job easier. Definitely from a school district standpoint, as we're having this conversation, it makes our job easier as well. So that would be, I'd love to engage in more deep systemic inequality, using a lot of the stuff that Dr. Egbuonye has done with the health inequities and pushing that, or excuse me, the health assessment and the racial equity tool, and pushing that forward in a partnership and continuing that throughout the community.
Mm-hmm. Such potential, right? And the timing of what you are already doing with the equity work, and then aligning that this year is just kind of incredible, because it really is setting us up to be responsive in the moment when we want to be responsive, right? When there's the passion and the deep desire and deep understanding, I think, that people have had this year. I know we're just like a couple minutes over, and so I want to do like a 30-second each of you. If someone is listening and they want to help your organization, they want to donate, they want to volunteer, they want to be engaged in some way, tell us what you need most, and then how people can get connected to helping. Pam.
So my ask of people are, if you know of anyone that is inspired to be in healthcare, point them, to us, and we'll take it from there. We'll even help them get their education and give them some great opportunities. We have all kinds of jobs available and are in need. We have a foundation that people can donate to. Our volunteers, we have wonderful volunteers, but 2 vaccines plus 2 weeks before they get to come back, because we love our volunteers.
Mm-hmm. Great, thank you. Nafissa.
Public health advocacy. This is a critical time for public health. I ask people, to really look into public health, the services that we provide, and understand that public health has an impact on your day-to-day life. If you're able to open your tap and drink water from it, it's because of public health. If you're able to, just go to the restroom, it's because of public health, And so I think that it's really important for people to understand public health, and as I stated earlier, public health is not healthcare. We want to be that support to our healthcare systems, where public health is about prevention, as Pam indicated, keeping people away from being sick. And that's really critical. But last but not least, because this is Martin Luther King's, I want to call it week, not just day. I think it's important that people take the time to better understand, why they think the way they think, and really understand that systemic racism is still real. It impacts people on a day-to-day basis. And it's time for people also that haven't been impacted by systemic racism to also try and better understand the issue. It's going to be uncomfortable for you, but think about the people that have dealt with this issue for, since the time they were born. And so I think it's time that we really continue to have those difficult conversations. That's why we didn't stop during the pandemic. We knew that COVID-19 was going to highlight the disproportionate impact, and we continue to have those difficult conversations because racism doesn't stop because there's a pandemic. It continues. And so that is my ask, is for people to really take the time to understand their values and how they can contribute to effective solutions that will unite us and help us to move forward.
Great. Thank you. Kingsley.
And I'll add three things just briefly. One, obviously we have Emily would kill me if I didn't say something about our foundation. We have a wonderful foundation. Please donate as aggressively as you can to the foundation. I hope I did a good job, Emily. My second piece would be, again, kind of in line with what Pam was saying. We have a wealth of opportunities in Waterloo schools. We're looking for individuals that are not necessarily just coming to work in a job, but impact kids' lives. And I mean that in the sense of really being change agents in kids' lives and moving them forward to, a different or a new tomorrow. So with that, the last thing I would say, just as an ask for our community in general, again, as Dr. Egbuonye pointed out in relation to MLK, I would hope that, obviously the people listening, but those that listen in the future as well, we really move past lip service in regards to the work that's needed to be done in regards to systemic inequities. Black Hawk County is positioned well, Waterloo is positioned well with the leadership it has across the area to do some things differently. I think what I've seen Mayor Hart do, I've seen people on the call do, has really been a commitment to action instead of just lip service. As I've participated in conversations across Iowa and sometimes across the nation as well. I just want others that feel like they may not necessarily know what to do, know how to start. Just do something. Just do something. I guarantee you it's better than not doing anything right now. And I think that if we can all do something and commit to that on an ongoing basis to challenge ourselves, and I know that Dr. Egbuonye just said, get comfortable about being uncomfortable. We'll be at a different place moving forward. We need to cause that cognitive dissonance in our minds to really move forward in a way that's a disruptive state, so we can learn and grow in a different way. So I'm excited for people to take that charge and move forward in a big way. I'm excited to partner with all the individuals on this call as well.
Yeah, and there are lots of individual opportunities, obviously, right? Lots of places you can go online and books, but also people could reach out to any of you and you would be tied in to what some of the community efforts are around anti-racism work and how to get plugged into groups and discussions and work that's being done in that area. So I would encourage anyone who's interested also that there are things happening. There are conversations that are happening and there's movement. So I want to thank you. I'm going to turn it back over to Mayor Hart to see if he has any closing words, but I just want to really commend the three of you for the work that you've done over this past year and beyond this past year as well. And thank you for providing such amazing leadership to our community. Truly, it's remarkable. And I love what you all said about Waterloo being in a special place where people are working together and there's great hope and there's just great potential. So thank you so much. Mayor Hart, I'm going to turn it over to you for any closing words you may have.
All right. And, I know you said a couple seconds ago that we were already a couple minutes over, so I do take that to heart. But I just want to say that we have some challenges locally, because you talked about what's about moving forward. And first, thank you for facilitating, great moderator as well. So thank you, and to all the panelists and to Joy and everyone that put this together. But we do have some challenges that our local community is facing, and what a fitting time to talk about some of those challenges, but also talk about how we can make those changes coming after the days of the Dr. King's birthday. And one thing I notice about this is that it's going to take all of us to make the correct difference in the lives of people. Waterloo or the Cedar Valley should never be first in asthma rates. It shouldn't be first in STD rates. It shouldn't be first in a number of areas. And, this pandemic, you guys have been in the trenches for a long time, but this pandemic has really exposed some things that we need to continue to do, continue to move forward on. So I want to thank all of you for your dedication and your sacrifice, and know that you have a mayor and a city here that is here to support you. And we are we'll do it. So thank you so much. Tomorrow's presentation as well at 6:30 will be none other than economic opportunity. We'll have Carrie Dara from Grow Cedar Valley. We'll have Robert Smith. We say you and I, but Robert is all things, right? We have Sharina Salas from CUNA Mutual and from the nonprofit sector, and Stacy Bentley from Community Bank and Trust. So that'll be an outstanding panel group tomorrow. But also it will be moderated by Joy Briscoe, whose resume is about that long, so I won't go through it all. So thank you so much, and I look forward to talking and seeing you all tomorrow as well. Have a good evening.
Thank you. Good night, everybody.